All right, ready to go here. Welcome to the show today. This is our second Spotlight interview for the Spotlight interview series. My name is Peter Imperato, and I'm the senior physical therapist at Greiner Physical Therapy in Speonk, New York. Our mission is really to upend the traditional physical therapy model by improving the quality of our care and maximizing the outcome for our patients. And we really believe that creating relationships and working with experts in the field allows us to better complete that mission. So, for this particular spotlight, we've chosen a local expert in the field of neuromuscular medicine who shares the passion of improving health for the local community. In today's show, we're going to discuss his clinical practice and just educate the community on the scope of his practice. So, today we're really fortunate to have Dr. Devan Trammel on with us. Dr. Trammel went to medical school at Nova Southeastern University. He completed a residency at Stony Brook Southampton Hospital, residency in family medicine. He is board certified in neuromusculoskeletal medicine in OMM, which is osteopathic manipulative medicine by the American Osteopathic Board of Neuromusculoskeletal Medicine there. He's in offices right now, Meeting House Lane Medical Practice in Wainscote, Long Island, and Westhampton Primary Care. And currently, he is serving as the program director of the Neuromuscular Medicine Fellowship at the Stony Brook Southampton Hospital. Dr. Trammel, we are very fortunate to have you on the show, and really just thank you so much for agreeing to be on today.
Of course, thanks so much for having me. I think it's great that you guys are doing this. Really brings good exposure and, just informs people about what you do, how you do it, and, how they can get better outcomes, get better health.
Yeah, love that. So the first thing that like people go online, they're gonna look up your name, right? Like they see MDDO. Like, can you just share a little bit the difference between those two and maybe some of the similarities too?
Sure. So there are way more similarities than differences. In medical education, the biggest difference is that medical students who are in osteopathic schools receive kind of mandated about, I think it's almost 3 hours a week or even more of lab time, where they're, in addition to learning about osteopathic philosophies and principles, they're kind of manually, evaluating the body as in kind of a different way, an osteopathic way. And they're learning actual treatments and techniques for, all kinds of stuff. But every DO student does this. The sad fact of data, which might be somewhat off, but roughly only about 10% of all graduating DOs do any type of osteopathic manipulation, and fewer than that, far fewer, probably we're talking in the few percentage points, actually kind of practice it regularly and do it as kind of a specialty, if you will. So we're kind of among the few. Most DOs that anyone would just encounter in the wild, if you will, are going to be urgent care doctors. They're going to be surgeons. They're going to be psychiatrists. They're going to do all of the other things in medicine, and they probably, outside of maybe some subtle philosophical, hopefully, perspectives that were imprinted in medical school, are going to practice almost identically as our allopathic counterparts. So we get additional training in anatomy. We get additional training kind of, as far as the osteopathic treatments and techniques. That is the big difference. Otherwise, we have a very similar curriculum as far as basic sciences, medical education, pharmacology, all of the above. I mean, that stuff is mostly identical.
Wow. And you're also board certified in neuromusculoskeletal medicine. So can you tell us a little bit about how that perspective has like shaped how you treat people? I mean, like in that word, you have neuro, musculoskeletal. It's like almost like putting those all together. How does that perspective like help you in treating patients?
Yeah, so this is again getting back to what I was saying about how not enough of us do this type of work. So this is a very small subspecialty within the osteopathic world. It is now open to allopathic physicians too. With the ACGME merger now, there's a pathway for allopathic physicians who want training in this type of work can get it also. But really what we intend on doing, and I'm going to harp back to a lot of the osteopathic philosophy that kind of does set us apart from our allopathic counterparts, We really aim to restore function and allow the body to heal itself. That's mainly kind of what we aim to do. And by restoring function and motion in the musculoskeletal system, the body can take care of most of the problems that it encounters, and that really integrates all of these kind of critical systems. The neurologic system, the musculoskeletal system, certainly the lymphatic system, respiratory system. All of these things play vital roles in how the body functions and how it heals itself. So the main approach and goal is really just to remove restrictions in the musculoskeletal system to allow better healing on one's own. So that really is kind of in a nutshell what the main philosophy behind kind of the approaches and the treatments that I specifically do. That's where it's mostly grounded and rooted. There are a lot of different flavors of it, and I won't get into too many of the details unless you really want more of the information. But that's the general overall approach and perspective, is that the body can take care of itself for most things, and sometimes there's just impediments in the way. And if we can remove those with a variety of approaches and techniques, then hopefully you can heal on your own, and your body will be able to get past whatever you're working against.
Yeah, I think even that like mentality that you're even explaining is like that's empowering for a patient too. Like they don't need something externally. Like the idea or the philosophy is that, just like you're saying, like the body is trying to heal itself, and like sometimes there are restrictions, and you're helping them with that. So that's, even from a philosophy like standpoint, that's empowering to patients. So what are some of the common or the most common like neuropathic issues that you're encountering at your practice, or that you're treating, really, because you're at multiple places?
Yeah, so I mean, there are a lot of different forms of, neuropathy. Whether the most common ones are either sensory mononeuropathy, polyneuropathy, entrapment issues. That's probably the most common ones that I personally deal with, and I'm probably our most successful in treating. Also,
Yeah.
but you also have diabetic neuropathy, inflammatory neuropathy, toxic, metabolic neuropathies. Congenital. There's all kinds of stuff, and again, the nice part about my approach and kind of the philosophy of osteopathic, treatment and manipulation is it doesn't really matter where or what's causing the insult, as long as I am able to address and promote kind of those self-healing mechanisms in someone's body and system. If I remove the restrictions, ideally that will help get them to the next step. So having said that, some of these things are obviously easier or harder to treat in that way. Some of these things, it's not just an entrapment issue where you move this and it frees up the nerve and you feel better, versus some are deeper and would involve more of probably the most common one is just diabetic neuropathy. So you have kind of insults to the nerves, and it's not as simple as just freeing up kind of something that is entrapping a nerve. But again, with optimal drainage and kind of good self-care, which goes even deeper than just kind of the manipulation, and is more kind of talking and working through health in general, you are able to make improvements in some of these things. The scope of treatment with nerve issues is broad, and again, the tools are pretty extensive too. It's not just that I do more than osteopathic manipulation. I'm also board certified in family medicine, and I have that foundation too. So I also, while I'm working with someone, will help them make sure their A1C is in a good place, or that they're drinking less alcohol affecting their nerves, et cetera, or their B12 is inadequate supplementation. So I really can take a pretty combined, holistic approach to their care, not just strictly musculoskeletal. I mean, I sometimes try and just wear my neuromusculoskeletal hat, just to kind of stay within my own bounds and scope. But a lot of my patients are also my family practice patients, and I am responsible for everything. So I get to kind of do it all at once, which I think does lead to better outcomes.
Yeah, absolutely. And I think what you're saying, like what gives you, again, like just an edge, is that holistic approach. Like we know that sometimes the medical system can just totally zero in on problems, whether, like we see it all the time. It's like we're zeroing in on an ankle, and this problem has nothing to do with the ankle. Like we go to the hip or go to the low back, and it's like their ankles like totally change. So how often, like, really, how do you like break that down? So somebody has something that you're suspecting is coming from the spine. and their pain is in their foot. Like, how do you break that down in layman's terms? Like, where do you start with even that evaluation?
I mean, forgive me if I'm interpreting kind of your scope and stuff like that wrong. I don't have the same limitations that you guys have. I know when I write physical therapy prescriptions, I have to zoom in on a body area, and that can be a limiting factor for you. Part of what I love about you guys is you appreciate the same kind of things that I'm saying, that you know that this just isn't an ankle problem, that this is maybe a shoulder problem or, a cervical problem, all of the above. But with what I do, I am able to diagnose and treat in the same visit, and I can kind of do whatever I feel medically necessary in most cases. So yeah, oftentimes, I guess for simplicity's sake, if I'm seeing a new patient, I'll start with the area in kind of concern of the complaint. But oftentimes, if I'm not getting where I need to be after a treatment or two, the treatment kind of expands to like the rest of them. And yeah, you're completely right. You'd be amazed at how many foot and ankle problems actually cause all kinds of things. If it's just even upper back or neck pain, if they're not meeting the ground, they're not interacting with the environment appropriately, that's going to throw off the whole gait cycle. It's going to cause imbalances in, all of the kind of kinetic chains that, control their posture and their position in space, and leads to, strain in a lot of different ways. So chipping away, removing restrictions in various areas will lead to, again, the body does it on its own. We just have to sometimes give it a little push in the right direction. So if we can remove restrictions in some of these areas, without even knowing it, people might kind of, oh, I started feeling better. I don't know what it was. And, I don't really care what it is half the time. If we improve function and we get symptoms under better control, and, it kind of has a nice positive feedback cycle, like, with exercise and movement, once you get moving, it feels good. People do more of it, and then they also have less pain and better function. So,
Yeah, well, absolutely. Um, and then what about, like, it's very interesting that you have these two backgrounds. You're treating osteopathically, you have your family medicine, and I feel like both of those things keep just saying, like, to me, it's a wide variety. Like wide variety of skills and what you see, but just interestingly, like I see, like you certainly see a lot of different like age groups, like young and old. And I was just wanted to ask you, like, how does that help you seeing like an age range? Like, does that help you in your understanding of just like perform like human performance and like how the body functions? Like, how does the age thing, like variety that you see, because you're in that family medicine, help you with that understanding?
yeah, I mean, it's fun being able to work with like really from birth to death kind of age groups.
Yeah.
For me, one of the things I like about the job is the creativity and kind of the different things I get to do. And certainly treating people of different ages has a whole different everything, in all honesty. When you treat a newborn, everything is soft, mobile, and kind of pliable, and almost does what you tell it to do, versus, treating very arthritic kind of postural strain that's been there for decades, certainly has a different feeling and needs different approaches. So it really allows me to be creative and kind of use different parts and approaches to really, again, that same goal that I always have. But yeah, both of my board certifications really focus on treating everyone. That's kind of part of the fun, and a lot of people don't appreciate that there are, from small little things that you'd never think of as something that can improve with manual therapies and such. The scope is tremendous, from kids with recurrent ear infections to, my son who's got huge tonsils and big adenoids and snores a lot and probably has apnea because of it, where he's getting a lot of osteopathic treatment. He's also getting, kind of some other things to expand his palate and improve function. So, he doesn't have any symptoms or problems, but this is something I'm just aware of that can be addressed with these things. And, he needs to get oxygen to his brain when he breathes to develop and grow. And, again, we're not treating a problem. He's doing great, but this is something we noticed, and it's a therapeutic target that we can kind of, I guess we have much more access and understanding of this stuff, can put attention into it. You know, so it really can be anything. We have a wide scope, and for, you know, we aren't just neck and back pain doctors. You know, that obviously is what we see and do the most of, and, you know, we're quite good at it. So, you know, I'm happy to see those patients, but it can be much more complex or subtle things even that we can address, or at least improve, or put in a good direction, or allow for other therapies to be utilized.
That's interesting. You were just talking about like your son not necessarily having problems per se, but like you're recognizing some of these things as a medical professional. Does sort of the osteo part like have a preventative side? Like, I mean, obviously you're a medical professional, so you're catching things before people may catch them outside of the clinic, right? Like, so do you treat preemptively? Like, how does that work as far as the osteopathic like strategy?
So we're kind of encountering some rough waters, or some like debatable territory, if you will, at least among my profession, and certainly among like insurance coverage and all of the above. You know, there's a lot of patients who want and feel benefit in kind of maintenance or like preventative type of work. They feel better when they get treated. Things move better. They feel looser, lighter. I mean, the things people say after a treatment are, you know, pretty broad and you know, kind of interesting sometimes. But you know, as far as like insurance coverage, you technically need symptoms. It can't just be, you know, I want treatment. That does not work as far as insurance getting to pay it for these treatments. So, you know, we are somewhat limited by that. You know, it's not hard to figure out, okay, you do have some pain in this area, we can work with it. But yeah, it is a little debatable. And you know, they're you know, it's good, at least in my practice, for my own interest and mental stimulation, to do more than just maintenance care, because oftentimes that kind of does get a little repetitive, regardless of how much benefit it gives patients or not. It is always fun and stimulating to have kind of a new problem with a hopeful solution. You know, there are definitely different conditions that, you know, can be treated and fixed in a handful of visits, and then ones that are, you know, due to, you know, numerous different factors, going to need and require some type of regular, you know, re-education or treatment. So it depends, but yeah, I mean, I do both. There are definitely some osteopaths who don't like the maintenance wing of our world, and, you know, I get it. I understand why, but I think there's a need. You know, the big problem still is there are not enough of us doing this type of work. If there were tons and tons of us, and you could go to, you know, 6 places in the, you know, East End and find people doing this, we're lucky that we have a training program, so we actually do have more bodies out here doing this work. But if you go to most parts of the country, you know, we just don't exist. So to find anyone doing this, let alone, you know, your schedule will fill up quickly with maintenance work. You know, which is its own thing. But
right. Are there patients that really, now it's like when people have asked me this question, it's always a difficult one to answer. It's not like an easy question, but it's like, if you could stack your schedule with, you know, a particular type of patient, and here we've talked about variety, you know, it's like, so you like the variety, but, you know, like, I think also the question really allows us to see like even the different passions within each clinician, and everybody has a little bit of a different, like, you know, passion about who they like to treat or the type of patient. Like, if you could stack your schedule, you know, with one type of patient, or a type of problem or a different body part, like, what do you actually find passionate about, or what are you passionate about, you know, in that field?
So it's actually a pretty tough question. You know, I think I'm passionate about a couple things, which make that a little bit harder to answer. I can tell you what I'm good at, and, you know, we all like being kind of successful in what we do. You know, there's a lot of a big spectrum of osteopathic treatments, and kind of what they might entail, and what the general approach is of that specific treatment. I'm good at the mechanical stuff. I'm good at finding things that don't move and making them move, and, you know, so kind of relatively mechanical treatments. There are, you know, much more subtle treatments that rely less on mechanics, that focus more on either neurologic function, fluid dynamics, energetics. I mean, there are all kinds of different things in this world, and some of them are much more subtle. I also like expanding what I'm good at. So it is fun to get ones that are a little tougher, that are outside of exactly what I know I'm good at. I know I have experience in this and I can do some of these things, but it is not my like default go-to. So my ideal schedule probably is a mix. It is probably, some things I actually struggle with or know I need to get better at. And, you do that by, putting yourself in there. And then obviously some ones where I get kind of good affirmative feedback. Yes. Wow. You have no pain. Awesome. Great. We're on the way. I think I'm ready to like space out your appointments and stop seeing you, because that is always my goal. I mean, one thing to just contrast with other manual therapies is, I never intend on seeing anyone, really outside of the very acute injuries more than a couple times a month, if that. And once I get you feeling better, I am quick to say, all right, let's see you in 2 months, let's see you in 3 months. Okay, and then if you do fall into that, you benefit from maintenance. I'm hoping to see you 3-4 times a year or something like that for, hopefully, yeah, I had a little pain here, but mostly I'm doing well, I'm functioning, I'm living my life and doing everything I want to do. But occasionally I have soreness, stiffness, pain, or whatever. And I certainly can help with that.
Yeah. One thing that's very interesting, because we have the same issue, right? Everybody wants to come to therapy forever, and you're just like, you're trying to find that, or help teach patients how to be independent. And actually talking about it, and the verbiage that even you have used is like sort of restricted, right? If we use verbiage like restrictions, people, again, goes back to that empowerment. Is like, if people feel that they're restricted, you can give them something to unrestrict them. Like, like they feel empowered, like, okay, you know what, if I do exercise, if I do move, I'm working on my restrictions. Of course, it's not specific like you, and it's not going to be that hands-on, like very specific diagnostic approach. But again, like, the more we're like creating independence in our patients and teaching them how to solve their own issues, like, they're going to just be so much better off out in the community. So just again, I appreciate that perspective. Someone comes to you and says, hey, am I a good candidate for osteopathic manipulative medicine? Like, how do you answer that question? Am I a good candidate?
Yeah, I mean, honestly, there are very few people that are not good candidates. I mean, some people might have better or worse outcomes. There are certainly some things that, like I said, even just me personally, or even my local colleagues are better or worse at treating. So, but I don't know if that means you're a good candidate. I would say everyone is kind of a good candidate for a trial of some of this work. I mean, it's mostly very gentle. It's not like we're limited by spinal fusions and stuff like that. I'd say we actually have a large amount of people that have post-surgical pain that we work with, and we are like their only option. They have done and failed this, that, and the other. Every surgeon says, I won't touch you. You've had 3 operations and now you're just stuck with medical management and pain meds and stuff. And we are, just like you, probably one of their only options. To help control symptoms and manage pain. So, even like kind of your far gone or your neuromuscular disorder patients, it's worth trying. Again, there are some things that we are better and worse at. I encourage most of my patients, give us 2 to 4 visits and see how you feel. If you are open to this type of work, I would say you are a good candidate for it. Even there are some direct contraindications to some of the things that we would do. So I wouldn't even try and do that. I mean, one obvious example, or not, maybe not obvious, we try not to treat undiagnosed or undifferentiated cancers. So someone that has even a skin cancer they're working up, we might stay away from that as there might be effects on the lymphatic system and mobilizing some cells that you don't want to mobilize. But there are other areas that we can work on, or other ways that we can work with you. So, there are very few people that are really not appropriate for it. I mean, some of the ones that are kind of not appropriate is, I work in the hospital too. We see patients who are acutely ill in the hospital. The biggest ones that we don't treat are ones we can't consent or aren't able to like really participate or can't get comfortable in with even light touch, which sometimes does happen. I mean, there are some things that we can do, but it's limited in some of those cases. But otherwise, there really are no there are very few, I should say, people that are not good candidates for at least trying it.
Yeah. The patients that we sort of have shared have certainly been surprised with like how good they feel after treatments from you. So it, like we encourage that to our patients, and certainly to like keep an open mind with their treatments, because there's a lot of people like look out there looking for less invasive treatments these days. Like there's a great push to just have less more conservative treatment. People are always coming to us and asking, like, I've tried this, I've taken this medication, I don't like the way this medication makes me feel, and like this is a great option, can be a great option for that. So what would you say on the education side of things, like that you are sharing with your patients most often? um, yeah, I don't know if that's a full enough question there, because it's, yeah, like if you
Yeah, no, I absolutely can jump off from some of that. I mean,
yeah,
I actually rely on you guys for a lot of that stuff, just in the interest of time. If I am, seeing a patient in most of the time half an hour time period, I am taking a history, kind of assessing what's going on, and then doing some treatment. I don't have too much time to really dive into exactly how they move and what they should or shouldn't be doing, stretching, exercise wise, movement wise. So I rely on you for some of that type of stuff. But I absolutely try and dive into that, and really finding the root cause of all of these things is really what I aim to do.
yeah,
It is not just like, symptom management, and I want to get rid of the problem. I want to find the problem. So I want to really be good with, I think the main pain generator is this structure or this area. And I want to really try and restore that function and motion to it, or,
yeah,
to, again, allow self-healing.
yeah. Do you have any like just patient success stories that really stand out to you, and like highlight the importance of your approach that maybe other people wouldn't have considered, or like using that method?
Yeah, I mean, I'll probably use this time to kind of speak about some of the things that are less like obvious. I mean, I could tell you
Sure.
about some back pain people that, oh my God, you treated me, and like one treatment and it goes away. That's obviously rewarding and fun to
Yeah.
hear. But honestly, like the work we do with children is probably like some of the most rewarding work that we do. They
Wow.
are some of the easiest patients to treat. Again, they are mostly pretty healthy. They have a lot of vitality. They haven't had all the insults that adults have behind them, their baggage, if you
Yeah.
will.
Yeah.
So they really treat very easily. The hard part about pediatric patients is you don't hold on to them like you kind of want to with your adult patients. If you're doing a good job and it's a really good thing to be treated with osteopathic manipulation, it's probably gone in a couple treatments and you lose them, and which is
Yeah.
fine. I mean, that's a good thing, but
Yeah. Exactly. They're better.
yeah, from the, again, I mentioned this earlier, recurrent otitis media is something that's, relatively, treatable. There's a lot of stuff in the head, neck, and face area, infants, and, even
Wow.
until you're almost at early adulthood, your skull and most of these bones are cartilage in a majority of their makeup, and they're very mobile and very amenable to manipulation. So these are some of the fun and different things that I guess I wish I had more of, just, and that's probably a PR or just understanding and knowledge in the general community that these are options. Probably, as an osteopathic profession, we don't do a good job advertising, which, I think is fine in some ways, but obviously it
Yeah.
leads to just less access, less understanding of exactly who we are, what we do, and how it works. Which, again, a lot of people, half of my job on an initial visit is really explaining what this is, and whether they're just referrals from my own kind of community. One of the most common things people tell me when I ask them kind of, hey, what do you know about this? What are you here for? They'll say, oh, I don't know. Dr. Blank Blank just said go, he'll fix it.
Yeah.
So I have to really do a lot of the work, and that's like a PR again. Like I just, we need better education, and obviously our big kind of uh, groups and advocacy organizations try and do this, but again, we are a small percentage of
Yeah.
physicians in the U.S., and specifically the ones that kind of focus on this type of work are even smaller. So we just don't have funding or exposure. I mean, a lot of our stuff is focused on even just getting insurance to cover this. So Medicare reform and things like that, which we actually do have great coverage. So we are lucky, but now we just need to get the word out. So things like this are helpful. There are all kinds of advocacy groups and campaigns to try and increase exposure and understanding of exactly what we do and who might benefit from it.
Yeah, no, it's really exciting stuff, and I think it goes even back to that conservative things. Those are the hardest things to gain traction and popularity, right? Because they're conservative. Sometimes sometimes other factors drive our medical system, right? I'm not going to point any fingers or anything like that, but it's like other things can lead the way, whereas some of the conservative options can fall to the wayside. So it's exciting to see this. Do you have, or are there any recent like advancements or technologies or even manipulations like that are sort of newer for you, like in your field? Like, what's the new upcoming things that you guys are seeing or treating or things like that?
So I'll speak more generally, and then I'll speak personally first. I mean, one of the, another part of why we don't have, I guess, as much exposure or common notoriety is it's hard to study. And I'm sure you know this in the physical therapy world too. A lot of these treatments, it's hard to utilize a research-based, evidence-based approach to manual therapies to things. It's, we are not drugs. You shouldn't try and make us make studies with tens of thousands of patients, because when you do it in evidence-based research on like a surgical procedure, which is more what we're like, you include 2,000 patients, and that's a lot. But for whatever reason, we get lumped into these like broad, we need large placebo-based trials, and that's not us. It doesn't work with manual therapies. There's a lot of subjectivity to it. There's a lot of art, which is what I like. I mean, I get to be creative. I get to do different things, and that makes it really hard in a very objective, evidence-based world to study and produce data that turns minds and opens eyes. So that is like kind of one of the barriers that we're up against, and so on the research base, there's actually, well, there are a couple people, and even at the local osteopathic school, NYIT in Old Westbury, they actually just got a functional MRI machine on their campus, and they're using it a lot for research, and it's awesome. This is like the future. This is how we can prove in an objective way that what we do makes changes, and beneficial ones at that. So functional MRI on the brain for some of the subtler things that we do is really changing the game. There's a pretty robust research coming out of Italy from using a lot of fMRI techniques to assess effects on the brain, on pain sensing areas, on all of the above. So that's like where the future of our profession and research is, and there are a lot of people that are passionate about it. And hopefully we will be collaborating with that school locally and kind of contribute to some of the research, because that's how you get things to change. And then on a personal level, I am absolutely very interested in ultrasound as a diagnostic tool, and also a therapeutic, to help guide. There are some things that are stubborn as far as manipulation goes, and nerve entrapments, etc., that actually do really well with ultrasound guided injection type of techniques. And having kind of a good firm anatomic background and understanding really makes this stuff easy. It's something that absolutely I want to do more of. We recently got our ultrasound machine in Westhampton, so that is something that I will include more of, especially for people that maybe I am not getting the results I want after a couple of visits and stuff. We have other options, which really can be very focused and targeted treatments.
Yeah, that's awesome. Actually, just can you touch on that a little bit more? So, what does that look like in the office, right? Like, is it a quick thing? Is it like a extensive thing? Are they going to have to leave the building? Like, how do you use ultrasound?
Yeah, so I mean, ultrasound in medicine, it's probably like the biggest boom in terms of like clinical diagnostic tools. That's just like accelerating to the point where it's going to become our stethoscope. It's going to become our otoscope. It's going to become our ophthalmoscope. You can really use the ultrasound in pretty much like everywhere. Maybe I'm exaggerating with the otoscope, but you certainly can use it on the eyes and get a lot of information. You can use it really all over the body, and the quality of the images really is accelerating to the point that it is almost more reliable than MRI in diagnosing. And it's real time. It's functional. There's a lot of like things that you expect to find on an MRI, but maybe when they're lying flat, you don't see it kind of impinging on the nerve, but in a functional way, it probably is, and their symptoms scream that. Ultrasound really gives you that. Hey, do this when I'm doing it. Okay, yeah, I can see that's impinging the nerve when you do that. So the real-time imaging with the resolution that we're now able to obtain with ultrasound is tremendous, both diagnostically and then also therapeutically. If I'm not getting what I need to with my hands or with the normal techniques I do, sometimes even just during kind of like nerve block hydrodissection type of techniques with ultrasound can really free up the nerve, and you see a nerve that's squished like this kind of plump up into a beautiful kind of normal looking nerve, and oftentimes function and symptoms improve along with that stuff too. So there's a lot of that's probably a big frontier on musculoskeletal medicine that has been in place for a while, but is only getting more routine and standard of care. So definitely incorporating that into our practice and as part of our training program with the fellows and the residents, it's very important.
Wow. To me, that makes sense. It's like having a device where you can look at it real time, in like that makes more sense to me than MRI, standing still and taking a picture of that. So one last question. What advice do you give for individuals who are looking to prevent some of the orthopedic injuries that you're seeing? Those who are active in sports, even for yourself, some of the methods that you've used to like just stay healthy. What do you sort of promote?
So movement, I mean, I can put on my family medicine hat and talk about wellness and lifestyle and all of the things too that are equally important. And I absolutely get into a lot of that with visits too. It's amazing sometimes how, all these somatic or musculoskeletal complaints actually can be, you might have a sensitivity to gluten or something like that, or, more subtle things, but, more oftentimes that is not necessarily the sole cause of it, but it can be contributing, which I'm able to get into. But, I am a huge fan of movement, and that's why, again, I think you guys do an awesome job. And you need to keep people moving. You need to keep them moving correctly, which is, a lot of people's problems, especially if they have pain syndromes. They move in a dysfunctional way, and if you don't restore that and they just start going for walks and exercising, they can sometimes make the pain and problems worse. So if you don't restore kind of good functional movement, then you really are up against something. But absolutely, the body is, again, smart and capable of healing in most of its ways if you kind of allow it. And I think, good, just regular exercise and even mobility work, all of the above is critical. I mean, that's the thing probably culturally that we don't do enough of is mobility work. And obviously that leads to lots and lots of musculoskeletal problems. I run 4 days a week and I lift weights 2 days a week, but I'm not doing any stretching or mobility work. No, not personally. I'm saying, I hear this all the time. But yeah, I do all these things and I don't do any mobility work. I mean, that's the big missing picture for injury prevention, if that's what we're shooting for. You need all of the above. You need good cardiovascular health. You need good, physical strength. But if you don't allow the muscles to kind of have good resting tension and laxity of ligaments, etc., then you're gonna be prone to injury. So,
yeah. Last parting thoughts for someone considering OMM treatment?
Yeah, I mean, give it a try. I think it's again, part of the problem is honestly us too. We only have so many people that do it, so people get frustrated with the schedule, and I can't get in for 2 months and stuff like that. And we're working on it. I am, the program director of the fellowship, so I am always trying to train and get new physicians doing this type of work. That is the only way that we're going to get more of it and more access to it. But yeah, absolutely, kind of be patient with us as far as the schedule goes, and give it a try. I think there are a lot of people that can benefit from it, and just don't know about it. So stuff like this is really probably helpful just to get the word out.
Yeah. Well, Dr. Trammel, it has been a pleasure just talking to you about this topic and certainly about your specialty. We appreciate your time and being part of the Spotlight series. And yeah, what can we say? We appreciate your time.
Yep. Thank you so much. And thanks for everything that you guys do too. I really appreciate your help.
Yeah. Okay. Solid.